So as I mentioned, my name is Andrea McCauley. I do want to introduce our speaker today, Leah Size, who is the Nonprofit Collaboration Specialist with the Helpline Center. And I will let her take it from here. Thank you.
Thanks, Andrea. Hi, my name is Leah Size, and like she said, I'm one of the nonprofit collaboration specialists at the Helpline Center. My office is located in Sioux Falls, and the rest of my team and the other wonderful folks and other departments I work with are out in Sioux Falls. I have with me today Shanice Weber. She's our awesome database manager, so she'll be helping out as well. And part of what I do is I connect with nonprofits and other organizations who help with the social services and also some health services as well. And I'm working on this really cool project that hopefully some of you can be a part of. It's called the Community Information Exchange, and I'll put a link to the webpage for more information, or if you are so inclined to fill out an interest form, it's on there too. So what the Community Information Exchange is a statewide collaboration of healthcare, human, and social service providers that are sharing information using an integrated technology platform and a referral system to coordinate whole person care. And our vision for it is to streamline connection between healthcare, human, and social service providers to address social needs and advance health improvement among populations at higher risk that are underserved. So our goal is to help people, and you can think of the Community Information Exchange, or CIE, like a cloud, where it's very secure. There's one technology that's used to communicate, so you can enter in notes and things like that. And that way the individual who's seeking care can just tell their story that one time, and they can get referrals to other organizations in the network to get the resources and care that they need. So it's super cool. I could talk for days about it. It's really interesting. But like I said, I'll put that link in the chat. So I did want to use the chat feature a lot. I know that with these webinars, there's limitations on who can speak. So I'm gonna have you answer in the chat if you have received a Helpline Center University within the past year. So if you've gotten information from someone who works at the Helpline Center about the programs we have, how to navigate the website, things like that. So if you could put that in the chat, that would be fantastic. And while you're putting that in the chat, I will hand it over to Shanice.
Awesome, thank you. Hi, I'm Shanice Weber, and I am the database manager for the Helpline Center. So today I am going to walk you through some of the resources on our website that are available to the general public as well as to you. So I'm going to go ahead and share my screen here. Okay, so if you haven't been to the Helpline Center website, I would invite you to do so and make yourself familiar with a couple things. One of the biggest, most useful tools that you could find on our website is the community directory. So if you hover over this community directory tab and you go to find help, this is essentially the public version of our resource database. So the database that our staff use to help provide information and referral to callers at 211, that same database is available to the public. When you get to this page, you'll notice that there's a couple steps here for you. The first step is that you need to enter a zip code. So you can enter by zip code, or if you need to, for whatever reason, you could also search statewide if need be. That option is there for you. I'm going to use Sioux Falls for this example. And then step 2 is that you would choose a category on the left. So we've broken these out into different categories. Each subcategory has some subcategories and then broken down a little bit further. Financial assistance, one of the biggest needs that we see for needs here. We've got housing assistance, vehicle. So for example, if I were to click on rent payment assistance, it is going to pull up any program that helps with rental assistance in Minnehaha County. I do get the question with the zip code. For example, Minnehaha County has umpteen different zip codes. If I type in 57105 versus 104, will it pull up different different programs? The answer is no. It just pulls any program that's in Minnehaha County. So from here, when you are doing a search, you have a couple different options. You can utilize the My List feature to add these programs to your list. So let's say I wanted to add community outreach. I would just click that green button. It's going to prompt me to enter my email address. I can either go to that list or continue on and add a couple more. Okay. Or I can save this entire search instead of saving them one at a time. And then I can click this view list. Now you'll see a handful of other ones here from different demos that I've done. But when I've saved those programs individually, they come up on this My List items up top. And then if you've saved the entire search, if I scroll down to the bottom, here's those category searches that I've saved. So all of the rent payment assistance in this zip code. And you can print both of these different types of save searches. The really nice thing about this is that it's also embedded. We've got the Google Translate. So up here, you could go down and switch this to Spanish if you were helping a Spanish speaking individual. And when I go to print that list, it's going to hold that translation. Oh. Okay. It looks like it's picking and choosing a little bit. Let's try this one down here. Okay, there we go. All right. So super helpful if you've got a bilingual, multilingual family or individual that you are working with. I'm going to switch this back to English here. Another really useful tool that we've got is our resource guides. Again, if you hover over that community directory tab and go to resource guides, you'll see this create your own guide tab. And we've got a couple different options to choose from. I think the most popular one of our resource guides is this basic needs resource guide. So you can again choose, put your zip code in, 57105. You can select which basic needs, what resource guide that you would like to choose. We'll do the basic needs. And when you hit next, it'll give you the option to select all of these categories, or you can select just a few. This is really helpful when you've got an individual, for example, we'll get callers that they've migrated to Sioux Falls, especially like August, September is a huge migration time for people. And so we've got a lot of people moving to the area and they really need a lot of resources to help get them on their feet and get going. And so this is a really good tool to give them that basic needs snapshot of all of the social service programs in the area. So for time's sake, I'm just going to select a couple. And then you're going to hit create guide. And it takes a couple minutes to load, but it will generate a really nice PDF that you can print out. And it looks like this. I would like to note the resource guide is not currently translatable, but that will be changing. We'll be able to translate this here coming up shortly. Okay. Does the zip code search only restrict to that county, for example? That's a good question. So it doesn't restrict to that county exactly, especially when it comes to cities. So if I type in 57105 or 57108, what it does is it orders the programs you see by proximity. And then there's like a certain radius on there where it cuts off. So Lincoln and Minnehaha are very close together. They're also in the same city. And so you will see a lot of programs that will show up on either search, no matter what zip code you put in, 57108 versus 57105. Even with certain zip codes in Sioux Falls, you may see a couple Del Rapids programs pop up at the very bottom of those searches because it's so close in proximity. But what you won't see is like a program in Watertown pop up when you're searching a Sioux Falls zip code. So a little bit of overlay there with the Lincoln and Minnehaha County. Good question. All right, and then the other resource tool here that I wanted to touch on today was our help sheets. On that community directory tab, if you go down to help sheets and click on that link, these are more topic-based issues that over the years we've gotten enough calls on that we have found it pertinent and helpful to our staff and to the general public to create a sort of help sheet. So there's different categories here. During COVID, the eviction help sheet was super helpful just to help individuals going through that process understand what their rights were. I think our most popular one, believe it or not, is creating an email account without a phone number. Every year it has about 30,000 or so hits. So I guess that's a thing. But some of the substance use and mental health help sheets can be very helpful, especially when you have a family who is trying to help a loved one with a substance use issue or a mental health issue, and they're just not familiar with that arena. Some of these help sheets can be super helpful. Okay. And then I'm going to jump back to Leah. Do I still have some time here?
Yep, you're doing really good on time.
Okay, perfect. On our Find Help, I know that there were a couple categories that we really wanted to touch on today for this webinar. And a couple of those were prevention programs. So on these categories here, if you go down to healthcare and scroll down, there's a tab right here that says prevention programs. So if I type in statewide and go to healthcare prevention programs, it will pull up anything throughout the state of South Dakota that has some sort of prevention program listed in that. And so one thing I wanted to discuss about our database is one of the questions that I got preparing for this webinar was talking about like state prevention programs. And when we talk about helping an individual, especially when they're calling into 211, we're trying to connect them directly to the organization that will help them with those services. I know the state recently just launched they've got like a stroke and heart disease prevention program going on. They've got a statewide diabetes prevention program going on. And those definitely serve a purpose. Here's the South Dakota Department of Health Diabetes Prevention and Control Program. But when we talk about referring an individual to an organization that can help them, what our staff are likely to do is to refer that individual to a clinic that states that they are one of those clinics that does diabetes management services, which is a category that we assign to clinics. And so as we continue to grow our database into the healthcare world, that is something that we are working to grow our resources in. Okay, I'm going to back out here. And I also wanted to touch on Native American specific resources or Indigenous programs. If you go down to the Special Populations tab on these categories, and right here we've got the Native American Indigenous resources. So if we go ahead and click on one of these, like Native American specific programs, and this is a statewide list right now. So you'll see that right now it's pulling about 170 resources. We've got an array. Some of these are schools, county offices, hospitals, etc. And then you can click through to the other Native American and Indigenous resources here on the left-hand side. I definitely think and know that the Special Populations tab serves a purpose. And we do get this question a lot of, being able to highlight programs that help a special population from whether that be the Indigenous community or the veteran community, LGBTQ community. And so we do try to highlight those in the special populations, but what I want to caution against is that what this doesn't include is all of the other programs that are available to everybody. And so what that means is like a food pantry that serves everybody or a counseling service that serves everybody is not going to be included in these lists for special populations because they're not providing a service that specifically helps the Native American community, for example. And so when you are utilizing this database or have questions in regard to, creating like a special populations resource guide, we get that a lot, like a Native American program resource guide. The hesitancy there is that we want to be able to also send them to all of those programs over here that are open to everybody as well. Okay, I'm going to pause right there and see if there's any questions. I keep checking the chat here. Does anybody have any questions right now? Okay. All right, I'm going to keep going. We've also got community calendars over here under the calendar tab. If you go down to community calendars, if you can filter by category, and the most utilized calendars are the food calendars over here. So if we click on Rapid City, for example, we've got whether that be a hot meal or a food pantry, they are all listed here by date and time. So that's helpful when you've got an individual that is trying to get to the soonest food pantry available. And this calendar is also embedded on our 211 app. So if you download that app, it's mobile friendly. You can get it on your phone. There's also Helpline Center events, community education, as well as an item giveaway calendar. We've got the Project SOS backpack distribution, dental care appointments. And so those are good to check out and see what's going on over there. And then one thing that I like to talk about too is if you are searching through the Find Help directory, the community directory, and you find that we are missing a program or your program is not listed, we would love to get that listed. And so on that community directory tab, we have this list or update your program. And if your program is not in the database, you would just click right here and we've got different intake forms depending on the organization you're with. And if you're a current resource partner and you just see that something is out of date on the website, you would go ahead and click the current resource partner tab and submit an update. All right. Well, I am so thankful to be here with you guys today. Leah, I'm going to hand it back over to you if there's no questions for me.
Thanks, Shanice. I don't see any more questions. Are you seeing any more questions on your end, Andrea?
I am not. Feel free to proceed.
Okay, well, let me double check that that's all we had on our to-do list. Yep, looks like we've covered everything. I did put my contact information and the link to the CIE webpage that I mentioned at the beginning, and it looked like it just sent to the hosts and panelists. So did that get passed on to the group?
I'm seeing the same thing on my end, so I believe so.
Great. Well, that's all we had for today. I definitely encourage you to reach out to myself or just to poke around the website. There's always really cool things popping up on the website. The app is very handy, especially if you're meeting with clients, patients, other individuals, and you're just on the go. Then you can double check to see what resources are available. So if you want to go through the app, definitely reach out to me and I can do a quick walkthrough with you. I'm always happy to do that. I just like to say thank you all for making time to come learn and chat with us today. And I hope to hear from you all with any questions that you have that come up.
I just want to say thank you to both Leah and Shanice for joining us today and everyone else that went ahead and hopped on the call. If you guys have any questions, feel free to reach out. We will send out a follow-up email with information, including contact information and anything you might need, but please just let us know if we can help with anything. Thank you, and I hope everyone has a great day.